Thank you so much for inviting me. And I think this is the need of the hour. There are so many podcasts, there are so many Insta reels and all, but still quality of information is lacking. What I see in my clinic is despite whatever is happening, somehow the message is not going through. So the more we do, the better it is for the women. Media is the best way because every woman spends a couple of hours through reeling through shorts or little YouTube videos or whatever. I think this is the right way to go. Um, See, the way I look at it, a woman who realizes her self-worth, woman is from times immemorial always the smarter and the more beautiful being that God has created. You know, people used to revere woman. Har ghar mein, I mean, in every village in India, there is Gram Devta. There is no Gram Dev. So it's like Devta is there in every village. And when the creation happens, the child knows its mom. It doesn't know he or she doesn't know his dad, and the mother introduces the dad. So once the woman knows, it's not just any person that has to do a certain job or should try to equal to do jobs equal to men. We are born superior. In fact, we should get equal cerebral opportunity. But as a creation, we are superior. There's nothing to, we are actually downgrading ourselves by making us want to be equal to that of men. So empowerment is making the woman realize her self-worth. If she feels good about herself, everything will fall in place. The things happen when she doesn't feel good. And especially, I mean, I think I'm going on and on, but in infertility, it's such a complex thing. It doesn't have the same kind of sympathy as some other disease. She feels inadequate and maybe some kind of reduced self-worth if she can't make a baby. This is coming from the infertility field. So each woman is worthy just being a girl because she can do what a man can do intellectually. He can't carry a baby for her, so she's born special. Empower each woman that she is better than the opposite sex that God has created. First thing is that I shall talk one by one. Puberty, when the periods start, a lot of girls stop exercising. Periods are just the beginning of reproductive life. Girls should be active and not on period and rest during periods. Now, this concept has gained recent scientific evidence. So, girls who strain during periods, who are very active during periods, end up having period problems. So girls must rest during periods and be active and not on periods. So this, they make sure that they are healthy. No, no, no. This is unfortunate, big misconception. The reason, very simple reason. See, when you're rested, let's take the example of heart, easy to understand. When we move, every organ in the body moves. Say for example, the heartbeat. The heart, when you're rested, say 50, 60, it goes to 70, 80 when you walk. When you run, it goes to 80, 90. Or when you climb up the stairs, it goes to 100, 110. The more active you are, the more active the heart becomes. Similarly, take the example of a bowel. If somebody is constipated, we give warm water and ask the person to move or do walking. After doing a few walks, the bowel will start contracting. Every organ in the body moves. So when the girl is active or moving during her periods, the uterus contracts. They are likely to bleed heavy. A lot of women say that, irrespective of what the media says. My patients say, when I went for a travel, this time the period is heavy, this time I'm having cramps. So what happens? The uterus contracts, and when it contracts, sometimes they might have backflow of blood and may end up with endometriosis, a painful condition of periods. So, whatever the ancient people have told, rest during periods, do minimal. I mean, obviously, you just don't sit at home because schools don't give holidays. However, in Japan and America, there's a big push towards leave even in school during menstruation. Menstrual leave is legal in Spain and some other countries. Sorry, I just started with puberty, then reproductive. It looks like a long podcast, but you cut whatever is not. Start with a good lifestyle first thing. And when I say rest during periods, in olden days they used to put the girl in a corner and all. She used to feel she's committed a crime or something. That feeling should never come. You tell rest beta, it's good for you, rather than putting her in one corner. Puberty should be associated with positivity rather than negativity. Happy, good menstrual habits, positivity with puberty. In fact, I kind of support the function that they have pubertal. She feels good. A lot of people come to visit. She gets new clothes. She gets sweets. She feels happy about coming of age on having the puberty or her periods, menstruation starts. So one is menstruation. Then in the reproductive life, plan your pregnancy. And if you are a career woman, or if you haven't found Mr. Right, or if you have a husband but there are other family commitments or something because of which you can't conceive, consider freezing your eggs or embryos, because the biggest thing that affects a woman's fertility is her age. As she gets older, she runs out of the eggs, and when they are totally almost zero, she's through menopause. So girls eggs reduce as she gets older. This is fertility point of view. The other thing is taking general health. Say if you have a baby, lot of women, they don't take care of their body after having babies. बच्चे हो गए, then पेट ऐसा ढीला रह गया. So after having kids, get back into shape, restart your social life. Yes, there are kids, but then connect with your friends so that you have a break and you be normal. You just don't feel like a cow all the time feeding the babies, doing household work. So many things women have to see. Nobody tells them, because if the work is getting done, men are happy. In fact, most men are actually not bad. They don't know what a woman is going through. She has to. She is the stronger one. She is the smarter one. She needs to take care of herself. Uh, and the better and healthier she is, the better she can look after the family. And then as women get older, yeah, change is difficult. So puberty is difficult. The girls may have a little regular periods and then it settles down. Change is difficult. Menopause again is difficult for women. Again, in this difficult time, make sure you have a hobby or some kind of exercise so that you go through the transition easily. May take care of your diet so that you're eating the right diet or the right thing at the right time. Take care of your food, maintain your weight, because it becomes harder after we get older. And of course, into the old age, as we get, make sure you get preventive health checks on a yearly basis. You see, in olden days women used to live for very long. If you see in the west, you say 80, 90 is actually a common thing. Women walk straight. So may take care of your bone health. There are medications to help maintain your posture. So it's a continuous thing. It's not that you take care at one point and forget the other. Sure, sure. See, gynecology is complex, and I think partly doctors are also to blame. We need to create that environment where the woman can approach. In busy clinic, a lot of doctors, they do not spend that much time because they are not able to, because of the number of women patients load we have. But the thing is, the most intimate parts that she can't even share with her family members, she's sharing with the gynec. So she should have that connect to the gynec so that she can open up and share lots of things. So it's heavily depending on the medical community as to how you create that environment so that women can confide in you, maybe spending a little bit of extra time or something like that. From the patient's point of view, it's not like in olden days. Women's uterus, ovaries, breasts, they are there for a reason, to carry a baby. Now women choosing not to carry babies or not being able to carry, the lesser babies you have or no children, has increased the risk of breast, ovarian, and uterine cancers. So if women, yes, women who don't breastfeed at all are at higher risk of breast cancer than somebody who's breastfed. Breastfeeding protects the breast against breast cancer. Carrying a baby protects the uterus against uterine cancer. Also, keeping the ovulation. It's not natural for the ovary to release an egg every month. Ovaries would like to take a rest. So using contraceptive pills where there is no ovulation happening, or carrying a pregnancy where the ovary is not ovulating for 1.5 years, this is protective for those organs. These organs would like to do something. Yeah. So, like you said, using these organs, I mean, putting these organs to use is very important. And nowadays, because they don't, most women postpone their pregnancies into 30, 35, 40. By the time they reach that stage, a lot of girls have little fibroids or little endometriosis, some diseases. And in fact, in putting in simple words, it's probably the frustration of the uterus of not having a baby that has developed this disease. बच्चा नहीं तो कुछ और बना लो. So so it's so get a preventive health check. It's not like we are marrying in early 20s and having babies before you touch 25. So when we are not using the reproductive organs, diseases are commoner these days. So go for a preventive health checkup. So see the doctor. And in fact, I wouldn't say this doctor is good or bad. Everyone has their own comfort level with one of the doctors. It's okay to have even with a family doctor. If you have one family doctor, advise him and he will send for a gynec checkup. Most importantly, I would say in young girls, have a cervical cancer vaccination. Cervical cancer kills one woman every 5 minutes in India, and it's a preventable cancer. Vaccination before girls start sexual activity. Once they are married, the viruses come from a man's skin into a woman's body. Have a pap test by gynecologist every 3 years until she is 60 or 65. So this is a yes, yes, yes. The viruses come from a man's skin, they colonize in our body, and it takes minimum 3 years for it to become cancerous. So if you check a pap test, which is a little gynecological test where we rub the cells of the cervix and send it for testing, if the cells are normal, very almost next to impossible that she will get the cancer in the next 3 years. Because it takes 3 years. In case we find abnormal cells, we can easily freeze or treat those cells before they become cancerous. So it's a preventable disease with a long precancerous course. And before starting sexual activity, there's a vaccination against the cancer causing viruses. Why not give the vaccination? In the West, it's given routinely, but in India, Sudha Murthy is trying to get it free of cost in the government's immunization schedule. It's available in the private. We have Western made vaccine called Gardasil as well as Indian made vaccine called Sarvavac. So Indian one is a bit more affordable, but both are available in the market. So breastfeeding preventive, I talked about cervical cancer prevention, uterine cancer prevention. If the girl maintains a healthy exercise weight and carries at least 2 3 babies, she is likely to be protected against uterine cancer. Now this is becoming common. The vulval and vaginal means vulva and vaginal are the external genital organs which are visible on the outside. It was very rare before. Nowadays it's becoming more common. And in fact, in the West, study says it's associated with the use of plastic and the pads that we are using. So going back to grandma's era, sit in a corner, use cloth pads which are much more gentler, breathable in that area, and protective to the vulval or area. So if possible, nowadays cloth pads are available, but they're not practical in schools. So maybe biodegradable pads or cotton-based pads rather than plastic-based pads. They are good, but they should figure out how to use them, because putting inside, taking out. Yeah, yeah. And I don't encourage young girls, because unmarried, okay, married women who have had children, it's okay. Young girls putting stuff and out, it's not okay. I've had a young girl where she thought it was the right thing to do. She put it. While pulling out, you have to release the vacuum and then take it out. She tried to pull it very hard, and the uterus almost half came out. She came in excruciating pain. Similarly, other thing that young girls do is using tampons. Uh, Again, I wouldn't encourage young girls to do, because she was bleeding heavy. She put 2 3 tampons and she has forgotten to take out. She came with horrible foul smelling discharge in the vagina, and she has got fungating forgotten tampon which was found in the vagina. The girl was just 17. So I would say be careful about putting anything in the vagina. Once you're married, or if you have normal delivery, all the more better. For, yes, for mature women, definitely I would say anything that is environmental friendly is good. For young girls, I would still prefer pads. Cloth I wouldn't say, because they would leak and it will stain their clothes when they go to school. It's not practical. Pads, but I would say switch over to cotton based. And if the girl has prolonged periods, she can use Vaseline or coconut oil as a barrier cream against the skin. So lovely. Pleasure is all mine. It's so nice to educate. More information needs to go out, really. I think what we are doing is not enough. Oh my God, the young people see it as a stigma. It's not changed much. Surprisingly, we think over the generations, the younger ones are more empowered. They take no. I have seen so many young girls with unconsummated relationships. They are married, living together like friends. They've never had sex. We think the Gen Alpha is a bit more open. They would have had sex before marriage. They are free and open. Oh my God. In my OP, on an average, say I see 20, 30 women, probably 10 new and 20 follow-ups I see. I see at least one woman every alternate day, or at least one in 50 women who have been married for 5 to 10 years say they never had sex. This is unfortunately common, even in us. Why? Too much information, so they are either too scared, or maybe they have had, lot of girls have had a love marriage. They've known that boy forever, and then जैसे फिल्मों में दिखाते नहीं, शादी के बाद अभी नहीं, be wait. So they think that is, they take it very seriously कि अभी नहीं, छूना नहीं, ना ना ना, शादी के बाद. So they don't touch each other. This goes on and all, and they get used to living friends. And a lot of girls feel ashamed and dirty if they have sex with the boy that they have known for so long. They feel that they have like very degraded, denigrated. This is the common feeling that a lot of girls say. The other sect of people, again, they might have been, maybe the first attempt might have been a bit rough, so many times we have to educate the men rather than the girls. Instead of having a foreplay, if they directly go for intercourse or penetrative sex. Yeah, yeah, yeah. No, I do spend time. Unfortunately true. No, no, I do talk. I mean, unfortunately, what you said is absolutely bang on. Just today, I've seen a woman. She had seen three different doctors. What they said is, your vagina is probably tight. And then one of the doctors gave her anesthesia, dilated, and said, you are ready to have sex. But that is when she's under anesthesia. When she's conscious, again, she cringes and then shuts down her body. So that's not the way to approach. And I think we need to educate doctors as well as the patients that this is not the right way to approach. And the boys are also as illiterate as a guy. Like in olden days, they used to switch off, people were young, and then god knows what happened, you have a baby, and once you have that, see, then they realize, bas itna hi hai, why should I be scared, this is so normal. So they accept it because it happened before they are complicated or anything. Nowadays they have so much information. Sometimes they google before marriage kya karna hai, how is it, or sometimes they are influenced by their friends who have had marriage before them. So they go with all these preconceived notions. And sometimes the boy doesn't know. Many times they look at the girl, first time they see so much of flesh, and they have ejaculation before they touch the girl. So the boys have premature ejaculation, they are in out of sync with each other. And the boy needs to be educated that it's not that, you need to hold on, you need to practice. And it's for boys it's more physical, it's more like a reflex. For a girl it's more psychological. So if the first intercourse is dry or traumatic, she probably wouldn't want to have sex again, even though she likes the man, whatever. That thing is scary. Or the third thing is, if her first examination by gynec has been painful or traumatic, she would never allow anybody to touch that area. Lot of women says, ma'am, I had pap smear several years back, it was so painful, I cried for 3 days, I even bled. Those women, when they come for a health check, they always say, can I skip pap smear? And I many times I swear that if it's painful, I'll leave my gynec practice. Give me time, I'll be gentle, it won't hurt. So this is not just me, and I think the junior doctors, we all need to train. Many of the senior doctors, they know, they have a way of with their patients, they are like their mothers. They talk to the girls, they reassure them when they do it. So this is gynec examination. Fourth, it's overrated, it's not so common, but if some kind of traumatic incident has happened in her childhood, somebody tried to touch her inappropriately, whether it's in her conscious memory or subconscious memory, she would never like to, she may not remember consciously, but she wouldn't allow anybody to come near the intercourse area. So these are the four things. Oh, infertility. Oh, they don't tell their people. Oh, the reason I've actually skipped a loop, but they never tell their family. They say my family doesn't know because they feel that the girls themselves feel that they are inadequate in some way. This is so normal. Whereas, like for example, if the girl has cancer, she gets all the sympathy. If she is infertile, if she can't have babies, they will not call her for the functions. You know, one of my patients was telling my brother-in-law had a baby, but I don't have baby. My not brother-in-law, my husband's brother had a baby, he's the younger brother. Me being the elder brother's wife, I don't have children, so they didn't call me for the party because they think I might put evil eye or I may not. This still exists in India. There's a stigma. Now, having worked in England in the West, even there it's a stigma because people take that fertility is for granted. You get no your sympathy for fertility, have being infertile. In fact, many times they blame the women. You left it too late. You've become old. You've been smoking. Okay, whatever that is, knowingly, unknowingly, those were her choices. Our job is to make sure that whatever has past had been, if she comes to medical doctor for help earlier, advise accordingly. But if she's come to you at this stage, you can't judge what has happened in the past. That is past. To heal her so that she can have a baby or whatever. There is a lot of stigma. Even in the West, they can't confide. In fact, many times I used to say, Doctor, I brought my friend to you because I found you very friendly, but don't tell I've had IVF treatment. No, this is very common. So stigma, how to beat the stigma? Explain that this not having a kid is also not always out of woman's choice, because the stigma exists because almost everybody assumes the couple don't want to have kids, they are the modern ones, alpha generation, they want, but many times they want to have and can't conceive either because of PCOD, endometriosis, fibroids, or just the stress of work. A lot of girls do night shifts. Night shifts are detrimental for fertility. Reproduction is an extra function which is not essential for life. So people traditionally or evolutionary wise were awake at the night when there was danger to their lives. Say for example a cheetah or a lion has escaped from the jungle and has come into the village, they light fire outside the village so that they're awake and alert when there is danger to their lives. Or there is a thief who's come to their village. People used to take turns to be awake. So, light after sunset, the way the body is wired, it always thinks there's danger to your life. So, when the girl is doing night shifts, when there is danger to her life, heart, liver, lung, brain, these are the important organs. Uterus, ovaries, making a baby is not essential. So she will have less fertility, low ovarian reserve compared with a woman who's working in the day shift, sleeping early and waking up early. Some more to answer? I can go on and on. No, thank you so much. Actually, there is so much information to share, and I think we'll do this again. And if the no, definitely the people watching, if they have any doubts, let them send to you. I'll be happy to come back again to answer the queries. Thank you so much, Som. God bless you.